Welcome back. In today's video, we're going to focus on follow-up care, an essential part of managing depression. When treating depression, it's not enough to simply initiate treatment. Ongoing monitoring and ensuring adherence to treatment are critical to achieving long-term success and helping patients lead fulfilling lives. Let's explore why follow-up care is so important and how it helps in supporting individuals with depression through their recovery process. Let's start with the importance of follow-up care. When someone is diagnosed with depression, they typically begin a treatment plan that may include medication, therapy, and other interventions. However, depression treatment doesn't end after the first prescription or therapy session. Follow-up care ensures that the treatment plan is effective and that the person's depression is being managed properly. The main purpose of follow-up care is to monitor the progress of the treatment and adjust the plan as needed. Many individuals with depression might feel better after a few weeks of treatment, and it's tempting to stop taking medications or attending therapy sessions. This can be dangerous because symptoms may return or even worsen if the person discontinues treatment prematurely. Why is adherence to treatment so important? Adherence to treatment is crucial in ensuring that the individual continues to see improvements. Non-adherence to depression treatment is one of the most common reasons for relapse. Whether it's forgetting to take medication, stopping therapy, or not following through with recommendations like exercise or sleep hygiene, these lapses can cause setbacks in recovery. During follow-up appointments, healthcare providers can check in on adherence by asking patients about their medication routines, attendance at therapy sessions, and any challenges they're facing in sticking to the treatment plan. These check-ins can also give the patient an opportunity to share any concerns, such as side effects or difficulties they're encountering, allowing the provider to adjust the treatment if necessary. Reflection questions. Why is it important to have regular follow-up appointments for patients with depression? How can non-adherence to treatment impact long-term recovery from depression? Next, let's talk about monitoring progress. Monitoring progress during follow-up visits is essential to ensure the treatment is effective. The healthcare provider should track changes in symptoms and assess whether the patient's depression has improved, remained the same, or worsened. A great tool for monitoring progress is the use of standardized screening tools, like the PHQ-9, Patient Health Questionnaire 9. This simple questionnaire allows both the patient and healthcare provider to track the severity of depression symptoms over time. It provides valuable data on whether the treatment plan is working or whether adjustments need to be made. During follow-up care, the healthcare provider should ask the patient about their mood, energy levels, sleep patterns, and overall well-being. The provider should also check in on any side effects of medication. For example, if the patient reports persistent fatigue or sexual dysfunction from an SSRI, the provider may consider switching medications or adjusting the dose. Why is it important to monitor treatment side effects? Monitoring side effects during follow-up care is critical because some individuals may experience adverse reactions to antidepressants, which can affect treatment adherence. Side effects such as nausea, sexual dysfunction, or weight gain may discourage the patient from continuing the medication. Open discussions about these side effects during follow-up appointments help healthcare providers address the issue proactively. Adjusting the medication or offering supportive therapies like psychoeducation or adding adjunct treatments can help mitigate side effects and improve the patient's experience with treatment. Reflection questions. How does tracking the severity of depression symptoms help healthcare providers adjust treatment? Why is it essential to monitor side effects and make adjustments to the treatment plan? Next, let's discuss relapse prevention. One of the key goals of follow-up care is to prevent relapse. Depression is a chronic condition that can recur, so it's crucial to create a long-term care plan that helps the individual manage their mental health and stay on track with treatment. Follow-up appointments allow the healthcare provider to discuss relapse prevention strategies. This might include continuing medication for a longer period to prevent recurrence, even after symptoms improve. Encouraging therapy as an ongoing support, especially cognitive behavioral therapy, CBT, which provides individuals with long-term coping strategies. Helping the patient identify early warning signs of depression recurrence so they can take action before the symptoms worsen. Relapse prevention also involves lifestyle recommendations such as regular physical activity, healthy eating, adequate sleep, and reducing stress. These activities can significantly reduce the likelihood of a depressive episode and help the individual maintain their mental health in the long term. Reflection questions. How can follow-up care help prevent a relapse of depression? What are some strategies that can be used to help patients maintain their mental health after treatment? In summary, follow-up care is an essential component of depression management. It helps ensure adherence to treatment, monitors progress, and addresses any issues, such as side effects or relapse prevention. Regular follow-up appointments allow healthcare providers to fine-tune treatment plans, making them more effective in helping patients recover and prevent the recurrence of depression. Follow-up care isn't just about monitoring medication or therapy. It's about creating a supportive environment where patients feel heard and empowered to take control of their mental health. In the next video, we'll discuss how to manage crisis situations in non-specialized settings, so you're prepared to handle more acute challenges that may arise. Let's keep it going, and I'll see you in the next one.